Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Dr. Chris Hart, Clinical Director of Oventis. It's a Brisbane-based medical device company established in 2012. Today, we're going to talk about the O2 Vent TM, a range of products designed for those who have problems with snoring. Without further ado, welcome to the show, Chris. It's very nice to have you here.
Thank you, Tabitha. Very nice to be on the show. I appreciate you taking the time to talk to me.
Yes, my pleasure. So, Chris, please tell the audience more about yourself and the nature of your work.
Sure. So, by trade, I'm a dentist. I have been working in the dental sleep medicine field for a bit over a decade, and I am also a severe sleep apneic patient and a chronic snorer. So, in this professional capacity, I was treating patients for snoring and sleep apnea with mouth guards. And for a lot of patients, they work, but for other patients, they don't. And the other option is using CPAP or continuous positive air pressure with the mask and the flow generator to treat sleep apnea and snoring. And like many patients, I couldn't tolerate that. So out of desperation, I developed a new device for myself. And the reason being is I couldn't breathe that well through my nose, and the back of my throat was collapsing. So I actually got some saliva ejector tubes, and I cut them up, and I fashioned them into a mouth guard and more or less gave myself a second nose. And that basically cured my snoring. And it sort of set me off on a pathway of developing the O2 Vent line of products in conjunction with two of our other founders, Michael Slater, who was the laboratory technician who helped me build the original devices, and Neil Anderson, our CEO, who took what was a fairly crude product and took it to the CSIRO, where we developed some proprietary software and we started 3D printing the devices in titanium. So that was a significant breakthrough for us. It made the devices commercial and increased the efficacy and wearability of the devices as well. So basically, it's a case of physician heal thyself. I had a problem, solved it for me, and since then we've delivered thousands of these devices around Australia and starting to treat patients with them in North America as well.
That's fantastic. So can you tell us, why is this product different from others?
Well, we have two main treatments, as I mentioned, is we have mouth guards that bring the jaw forward to clear the tongue from falling back, and then we have masks that we pump air through to inflate the airway. The mouth guards, while they're comfortable to wear, they often don't get a desired result. They're not efficacious enough. And the CPAP, while it works for most people, it's very difficult to tolerate, and around half of patients abandon treatment at the end of the first year. So the difference that we have is that within the mouth guard, we have a three-dimensional hollow airway, and that airway acts as a second nose. So it allows the air to flow through the mouth guard straight to the back of the throat in an enclosed airway. So the jaw, the lower jaw, is in a stable position, and the tongue's where it should be. And we're letting the air flow around the nose, or below the nose and soft palate, around the tongue and into the back of the throat completely unobstructed. So the core technology is actually our 3D airway, which we would call a second nose. We're giving the patients a second nose to breathe through, and that's increasing efficacy for the mouth guards. And for many patients, it's meaning they don't need CPAP as much anymore, particularly for those that are struggling to use CPAP. At the same time, this airway we can incorporate into a CPAP interface. So instead of needing a mask, if the patients need CPAP, we can use the mouth guard as a CPAP interface. That's not in market yet. It's still in clinical trials. That'll be available towards the end of this year. But the key point of difference is this O2 Vent airway that we incorporate into all of our devices.
That's good to hear. Now let's talk about sleep apnea. What is this condition and what are the symptoms?
So sleep apnea is where a patient would either stop breathing or their breathing slows down during sleep, and it can happen multiple times an hour. It can occur because patients have a loss of muscle tone in their throat. It can also be worsened by nasal congestion or a blocked nose, and also long floppy tissues at the back of the mouth, such as the soft palate and the uvula, which is your little boxing bag there. So what happens is when the breathing stops, the oxygen levels fall dramatically, or even before that happens, the reduced flow in the airway tells the brain that you're not breathing properly, wake up. And so patients have reduced oxygen levels and or they're waking up multiple times through the night. Consequently, in the morning, patients can wake up feeling extremely tired. They can have a poor cognitive function and concentration. They can lose productivity during the day. They're at dramatically increased risk of a road or transport accident or workplace health and safety issues, as well as having reductions in productivity. So in the short term, it can be very harmful to a patient, and obviously their bed partner can be interrupted as well because chronic snoring is very tightly correlated to sleep apnea. So that can be a huge social problem, causing issues within households. In the long term, these breathing interruptions lead to low oxygen levels, which can then lead to cardiovascular risk, so increased risk of heart attack or stroke. It can lead to hypertension, increased blood pressure. Diabetes is closely related to sleep apnea as well as obesity and depression. So, look, it does have some very serious long-term health effects as well as some short-term effects on lifestyle and health and well-being and productivity and relationships.
Thank you so much, Chris, for explaining about that. Now let's talk about treatment. Is there any treatment or medication someone can take with this condition?
So the main forms of treatment are CPAP, continuous positive air pressure, where we pump the air into the airway through a mask to inflate it, which is very effective but not often well tolerated. Then we also have mouth guards, which draw the jaw forward, which will deal with the tongue base obstruction but won't do much if there's nasal congestion or a soft palate collapse, the back of the throat collapsing in above the tongue level as well from the side. You can have surgery, which does have some success and is indicated in some cases. Obviously, some morbidity associated with that. And there are some medications, it's been shown in clinical trials, although not commercially available, that can improve the situation as well. But if you look at the triage of patient care, it generally starts with CPAP because it is the most effective. And if someone can't tolerate CPAP, then a mouth guard is the next stage of treatment, or surgery and CPAP. And they're the mainstay of treatment. Obviously, weight loss and behavioural management, sleeping on your side, and these types of things can also help. From our point of view, we're trying to help those patients that can't tolerate CPAP, and also the mouth guards aren't effective enough for them. So we either want to make the mouth guard more effective, particularly if they have a blocked nose or increased issues in the upper airway above the tongue, because we can bypass those issues while at the same time stabilising the tongue. Or if they're struggling with CPAP in the future, we hope to be able to offer those patients mask-free CPAP at very low pressure, so we deal with the issues with current treatment options.
That's good to know. Chris, I would love to talk to you more, but we're running out of time. But before we go, what is your main takeaway message to all of our listeners out there?
For all of those patients that, are struggling with current treatment modalities, we have another treatment option for you. I think we can help a lot of those patients get back into care, and our clinical data is showing that around about 50% of patients are getting a dramatic benefit from this technology, whether it's in the mouth guard or whether it's as part of a CPAP treatment or CPAP interface. There's a lot of hope for about half of patients that are currently struggling with treatment.
Excellent message. And now, for those who want to purchase these devices, how can they do that?
They can go to our website, which is Oventus, Oventus, oventus.com.au. We have contact details there for our office and also for the clinicians that deliver the technology around Australia. And they can also give us a call on 1300 533 159. So all that information, plus more information on the technology, is available on the website at oventus.com.au.
Excellent. Thank you so much, Chris, for coming on the show today.
My pleasure. Thank you, Tabitha. I appreciate you having me on the show.
And that was Dr. Chris Hart. We've just been talking about the O2 Vent TM, a range of products designed by his company for those people who have problems with snoring. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.